I just cannot do this anymore. I can't. I wish I wouldn't have wake up this morning. Will anyone even notice if I'm gone? I am so tired of pretending that I'm okay when I'm not. I just cannot go on. These are not just phrases. They are warning signs. These are the kind of words that employees may say, sometimes quietly, well, sometimes jokingly, that could actually be a cry for help. And in human resources, we're often the first ones to hear them, not because we're trained therapists. We are not. But because we are the ones people trust when they don't know where else to turn. Well, that's why today's session matters. Welcome, everyone. Welcome. Good morning. Happy Wednesday. Thank you for being here this morning. Anel Galejarza joining you today from my quiet home office in Simpsonville, South Carolina. Thank you for being here. I already have my 2 cups of coffee so far. For 30 years, I have lived and I have breathed human resources. And some of you who know me, you know that my goal is to make it to 50 years in human resources. Well, I already got 30. What's 20 more? As a matter of fact, lately I've been saying, I got 30. What's with, 30 more? Oh no. Well, I think I'm going to get the World Guinness record because nobody wants to work 50, 60 years in human resources besides me. I am the proud founder of HRTrainingClasses.com, and I do hold all those major certifications that you see after my name. But you know what? Beyond the titles and those acronyms and those certifications, credentials, what drives me the most is the people. It's their growth, their resilience, and the stories behind every workplace process. And I am so grateful that you're here to share this journey with me. Well, first and foremost, I need to let you know that I'm not an employment law attorney. But you know me, I believe that there is an attorney who lives inside of me ever since I started working in HR 30 years ago. I was passionate since day number 1 when it comes to employment laws. But I need to let you know that any recommendation, any insights that I provide are based on my professional knowledge and my experience, as they reflect what I will do in a similar situation. However, if you require legal advice, I strongly recommend consulting with a qualified employment law attorney. Alrighty, and in Simpsonville, South Carolina, like I said, it is 11:03 here. This training session is being recorded and it will be available on our website for future reference. Behind the polished role of HR, what do we have? Compliance checks, policy updates, employee relations, investigations, payroll, performance appraisal, training. There is a reality that we don't talk about enough. Employees who are silently struggling. Worse, we sometimes dismiss as maybe just a stress, but that could actually be a cry for help. And here's what I have learned in all my years in human resources. A suicidal comment should never be brushed aside. Human resources is often the first person to hear those words. Responding with compassion and compliance can literally save a life. Do you know what that means? It means that HR is not just about policies and rules and paperwork. It means HR is on the front lines of humanity at work. We're expected to support everyone else. But when the stakes are this high, we, HR professionals, we must know how to respond, what to say, and what not to say. That's what this webinar is about. This is This is your hour to pause, to slow down, to learn, to prepare, to walk away with awareness, awareness of the warning signs, guidelines for immediate response, scripts that you can use and what to say and what not to say, tools to balance compassion with legal compliance. So join me, not just for another training, but for, let's say, a conversation that could help you be ready when it matters the most. So what are our training objectives? Well, we want to equip HR professionals, supervisors, and compliance leaders to recognize warning signs and suicidal comments, to respond with compassion while respecting legal compliance boundaries, to act effectively whether or not the organization has an employee assistance program, to build workplaces where suicide prevention is normalized and is not ignored. So here's what we're going to be covering this morning: the introduction, why this matters now, identifying the signs. We'll look at some real-world examples, what to say and what to avoid, creating a culture of preventive care. So leadership means having the courage to host a conversation that others avoid. That's where we begin today. Suicide in the workplace is one of the hardest conversations that we can have. No, I agree. I have had those conversations, but it's also one of the most necessary. This month, the timing is intentional. September is National Suicide Prevention Month, and September 10 was World Suicide Prevention Day. These moments remind us that awareness cannot just live outside of work. It has to live inside our workplaces too. And that's where HR comes in. Because in human resources, we just don't manage policies. We lead people. And when it comes to suicide prevention, that means leading with both heart and policy. This webinar is not just about compliance. It's about humanity. It's about being ready when someone's words or even silence could be a cry for help. Why this matter now? Well, you know that suicide rates are rising. In 2024, the US age-adjusted suicide rate reached, as you can see here, 14.7 per 100,000 people. You know that this is the highest level our nation has seen since 1941, 84 years. The highest that we have seen. Don't you wonder what's going on, right? That means despite decades of awareness and medical advances, more people than ever are losing their lives to suicide. And, it's not just a community issue, it's a workplace issue. In 2022 alone, 267 people died by suicide in the workplace, a jump of more than 13% from the year before. That represents 267 co-workers who didn't go home. 267 teams forever changed. And behind each statistic, you know that there is a family, and there is a department, and there is a ripple effect of grief. When we zoom in at the regional level, the picture becomes even more concerning. Several counties in Michigan, for example, have seen alarming spikes in suicide death, so much so that public health warnings had to be issued. And nationwide, indigenous and rural communities continue to be disproportionately impacted, carrying rates that are far higher than those in urban centers. What's the lesson here? Geography and demographic does matter. Risk isn't distributed equally. And as HR professionals, HR leaders, we must be especially aware when working with vulnerable populations. But I also want us to see the glimmers of hope. You know that among youth age 12 to 17, both suicidal ideation and attempts have actually declined between 2021 and 2024. Well, that's progress, right? And it's worth celebrating. Yet, suicide still the second leading cause of death for people ages 10 to 34. In other words, while some numbers are trending downwards, the danger is still very, very real. And here's a critical gap awareness. Only about 15% of adults even know that the 988 Suicide and Crisis Lifeline exists. Yes, we know about 911, but what about 988? That means the vast majority of people don't know where to turn when they, or maybe someone they love, are in crisis. Imagine how much suffering could be prevented if more people had that number memorized, just like 911. This is where HR can play a direct role, raising awareness, sharing resources, making sure that our employees know what help is just there. It's just 3 digits away. And I also want to bring in the national strategy. In 2024, the CDC emphasized that suicide prevention is not just a public health issue, it's a workplace issue. The national strategy calls on employers to take responsibility for shaping a culture where mental health is supported, where warning signs are not ignored, where leaders from HR to supervisors have the tools to act with both compassion but also with compliance. So why do this matter now? Because the numbers are telling us that this is urgent. This is for right now. Because real workplaces are losing real people. And because HR has a unique and a powerful position to step in, not as clinicians, not as counselors, but as leaders, leaders who recognize warning signs, respond appropriately, and connect people to the help that they need. So let's talk about something that can feel deceptively simple, but is absolutely critical, and that is identifying the signs. First, we have the direct comments, and these are statements that are clear and unmistakable. Things like, I just cannot go on. I wish I was dead. I wish I wouldn't wake up this morning. When someone says this, even if they say it casually or in passing or even with a nervous laugh, it must be taken seriously because these are the red flags that we just cannot ignore. Then we have the indirect comment. The indirect comment, this is where things can get, I would say, tricky, because sometimes the words don't sound as obvious, but they carry just as much weight. An employee may say, you will be better off without me. I feel like I'm just a burden. Or even something like, what's the point anymore? They may not use the word suicide, but these are still crises and cries for help. Because beyond the words, we also have behavioral changes. And this is where we, HR professionals, this is where we need to be observant. Look for sudden withdrawal. An employee who was once engaged now seems detached or isolating. Watch for a loss of performance. Somebody who had good performance and now we see the decline in the performance, missed deadlines, unexplained absences when the person had perfect attendance, or work quality sleeping. Notice if someone is giving away possessions, maybe making goodbye type comments, or subtly engaging in risky actions. These behaviors are signals that something deeper may be going on. And here's where HR has a unique responsibility, knowing how to respond with or without having an EAP. If you have an EAP, the process should be structured. It's not enough. It's not enough just to hand someone a phone number. You want to provide a one hand off, meaning you walk with the employee through the steps of contacting EAP. I have done that. I've been holding their hand and helping them step by step. Or you sit with them while they make the call. Or you follow up to ensure that they actually got connected. You know, that personal matter, that personal connection is going to be so critical. But what about if your company doesn't have an EAP? Well, this is where preparation is everything. We should build our own resources list. The 9AA Suicide and Crisis Lifeline, local crisis centers, hospitals of urgent care, nonprofit organizations that specialize in mental health support. Having this list ready before you need it is going to ensure that in a crisis, you're not scrambling, that you already know what to offer. And let me be very clear. Identifying the signs doesn't mean diagnosing. That is not our role. It means observing. It means listening, knowing when a statement or a behavior is a signal that someone may be at risk, and then connecting them to professional help. So we got direct comments, which are serious, but also indirect comments are also serious. Behavioral changes are serious. There's no such a thing as overreacting when someone's life may be at stake. This is why human resources professionals must be trained to not only spot the signs, but also to know what immediate steps to take, because hesitation or dismissal could be the difference between life and death. I had a couple of situations in corporate America dealing with employees making suicidal comments. There was one situation that this was about 15 years ago. So I guess I have been in HR for already 15 years. And I thought that I knew exactly what can I do when somebody makes a suicidal comment. Ooh, that's what I thought. I'm just gonna give them the EAP pamphlet. So the distribution center manager asked me if I could meet with an employee who had made a suicidal comment to his manager. He had mentioned when the manager said, "How was your weekend?" that the employee said, "Oh, it was horrible. You know, I'm getting divorced. I was drinking. I was cleaning my guns, and I thought about killing myself." So the distribution center manager asked me if I could take care of that. And I said, absolutely. That's what I thought, that I knew how to take care of this. So I contacted the employee and I told the employee that I was concerned about the comments that he had made to his manager. So I went ahead and reached out for the EAP pamphlet like I usually do and gave the pamphlet and the directions to the employee on what to do. To my surprise, the employee said, "No, I'm not calling." And I never expected that. All the employees would say, "Okay, Olga, thank you. I'll go ahead and give them a call." No, not this employee. He made it very clear, "I'm not calling." What is it that you don't understand from this? I am not going to call them. I am not going to contact a stranger and tell them about my personal problems. Okay, so I tried. was not going anywhere. So I knew that I needed to do something else. So I basically, told him to go back on the floor and to reach out to me if he needed any assistance. He left. So I went ahead immediately and contact EAP. And I said, I'm missing something over here. What am I missing? What happened when the employees do not want to contact EAP? So they said, hold on, Elga. They went ahead and contact the employee relations department and got one of the attorneys from the company. And they told me that I needed to do a mandatory referral. I didn't know what they were talking about. Well, that day I learned that when employees make suicidal comments in the workplace, that this is very serious. And having a workplace violence prevention policy when employees make comments about hurting themselves, it's the same thing as making comments about hurting somebody else in the building. They are violating the workplace violence prevention policy. So basically, they told me that we needed to do this mandatory referral where I met with the employee and it was not begging him to please contact EAP. No, these were direct instructions that he needed to call EAP within 24 hours or he was going to be losing his job. Oh, yes, mandatory referral. And he had to be evaluated by a psychiatrist in order to be able to return to work. Very, very serious situation. Well, within just 1 week of that situation happening, I had another situation where there was a supervisor who came to me and said that the day before they were issuing, it was her and her manager, they were putting an employee on a PIP, on a performance improvement plan, and that the employee started crying and crying as they were giving her the performance improvement plan. And when she asked the employee why she was crying, she made a comment, something like, I wish I wouldn't have wake up this morning. This is why every morning I wish I would be dead and not wake up in the morning. So I asked the supervisor, what did she say? What did she do? I guess the worst thing that we can say, she went ahead and told the employee, this is the supervisor, she told the employee to leave her personal matters outside of the workplace. To leave her personal matters outside of the workplace. And then I asked, what did your manager say? The manager said, do you want to take vacation? Do you want a couple of days vacation? Well, this is when I realized, well, I need human resources. Been in human resources for 15 years. And I thought that I knew how to deal with these type of situations. I didn't know. Well, how could I expect then my supervisors and my managers to know how to handle these sensitive situations that work? That's when I went ahead and decided I need training. I need to do more research and I need to provide a training to our leadership team. And I also learned that when we have an employee who is making suicidal comments in the workplace, the first thing that we need to do is we need to ask them right there if they are suicidal. We need to ask them right there. And if the employee says that they are, we need to contact 911. That's what we need to do. So most employees are going to tell you, no, I'm not suicidal right now. However, I've been thinking about it. I thought about it. I've been thinking about it, but not right now. We need to provide support. We need to provide EAP. Now, most organizations, I'm going to say 97% of large organizations provide EAP. However, we know the reality, right? They are underutilized. 97% provides them, but they are underutilized because employees are afraid of the sensitivity and the confidentiality issue. They think that because the employers are the ones paying for this benefit, that we're going to get information. No, they need to understand that there's nothing that we can obtain information from them. Okay, I want to go over some real scenarios. Real scenarios. Does anybody know who she is? Cheslie Kryst, right? So Cheslie was Miss USA back in 2019. You know, she was an attorney. She was an Emmy-nominated correspondent. From the outside, I mean, look at her. Beautiful, right? She was radiant, high achieving, high functioning, deeply, deeply admired. But you know that behind that polished exterior, she was silently battling depression. Her death by suicide back in 2022 shocked the world because it shattered the myth that outward success equals inner well-being. That's not true. So here's the HR lesson. We cannot assume that because someone looks like they are thriving, that they are. We see the exterior, but we cannot see the interior. There's so many people suffering of mental health problems, mental illnesses. I used to think that depression was number one. And if you know me, you do know that I do. I'm very open. I do suffer of depression. So all this is very close to me, very real to me. But anxiety is actually the most common mental health problems in the US. Anxiety, then is depression, and then is PTSD. Of course, I suffer a little bit of depression and I suffer, a little bit of anxiety and more of depression, okay? Well, high performers, even those who seem unstoppable, may be carrying pain that no one sees. So we must be observant and we need to be compassionate, even when employees look fine. And we don't want to judge. We cannot judge. We need to be there to listen without judging and to provide support by providing the assistance, the 988 number, providing EAP, providing resources. There's so much going on right now. There's so much stress. So much stress, the administration, the tariff, unemployment. I mean, every day, almost every day, I get a phone call of one of my HR friends, losing their job. There's so much unemployment. This causes a lot of stress and depression. There's just so much going on. And just like I mentioned last month, if you joined us last month on the last webinar, we, human resources professionals, we're supposed to be there for everybody, right? We're there for everybody. And who is there for HR? Who's there for us? Ourselves, me, myself, and I. So we need to be, we're a family. We need to be here for each other. Does anybody knows who this little girl was? Jocelynn Carranza, 11-year-old girl in Gainesville, Texas, who tragically died by suicide February this year. 11 years old. She had been targeted with relentlessly bullying. Her classmates told her that ICE was gonna deport her family. Comments that created fear so overwhelming that she could no longer cope. The HR lesson. Here's sobering. Environment matters. Words can kill. especially little ones. There's just too much that they cannot cope. If we as adults, it's so difficult many times, imagine innocent children. Now, while this story took place in a school, it's a mirror for our workplaces. Imagine, our employees being separated, from their family members losing their parents, their siblings. Xenophobia, harassment, bullying, these are not minor issues. They can destroy lives. So as HR professionals, our role in creating a safe, inclusive culture is not just compliance, it's literally life-saving. Who doesn't remember Robin Williams? A brilliant actor, a beloved comedian, someone who made the world laugh for decades. Yet, in 2014, his death by suicide stunned the globe. Robin's passing reminding us of a heartbreaking truth. Even joy and humor can make deep despair. And sometimes they say that those people who wants to make everybody else feel happy and make them laugh and joke and they want to see others happy, sometimes those are the ones who are struggling inside. So what's the HR lesson here? That even the employee who seemed the most cheerful, the ones lifting others up, they may be quietly suffering. We cannot assume that a smile means someone is okay. So easy, right? To just pretend and smile. Sometimes the strongest outward persona belongs to the person who is holding most inside. So why do I share these stories? Because each one teaches us something about what HR must look for. Success doesn't equal wellness. Environments either protect or harm, and appearances can be definitely deceiving. So as HR professionals, we must create workplaces where people feel safe to share what they are going through and where warning signs are not overlooked, because silence and dismissal or assumptions can cost lives. So some case studies, these are from the US also. Okay. I wanted to find some definitely dealing with workplaces. Okay. So we got John Barnett, the Boeing company. John was a quality manager who raised some safety concerns after decades at his company. Safety concerns. So guess what? Instead of being supported, his family alleges that he faced retaliation in isolation. His mental health declined, and in 2024, he died by suicide. What's the lesson here? Whistleblower retaliation and silence can be fatal. So HR must ensure safe reporting channels and protect employees who speak up. How about UPS? This was in Portland, Oregon. In 2022, a 46-year-old UPS package handler died by suicide. And this happened at work. Colleagues describe grueling hours, unsafe conditions, and a culture of silence around mental health, right? No, don't talk about mental health in the workplace. No, don't mention depression, anxiety, bipolar disorder, schizophrenia, PTSD. No. Yes, we know that nowadays we want to talk about it. Companies want to talk about it, right? And we know the whole reason behind, because we want the employees at work. Let's be real. Okay. Well, what's the lesson here? high-pressure environments without support put lives at risk. So HR professionals, HR leaders must ensure both physical but also psychological safety, right? I know that we are responsible to ensure that we are providing workplaces that are free from any recognized hazards, as the OSHA general standard clause says, right? But we also need to ensure not just the physical safety, but also the psychological safety. So we have very different industries with very different roles. But you know what? The risks are the same. Silence, retaliation, neglect. So as human resources professional, we are the safeguard, ensuring that employees can speak up, be heard, and get the support that they need before it is too late. What to say and do, and what to avoid. Well, this is the part that makes most HR professionals nervous. I get it. I understand. What do I actually say if an employee makes a suicidal comment? Yes, we worry about saying the wrong thing, or making the situation even worse, right? Or maybe crossing a legal line. So let's walk through it. Let's look at it step by step. So first, what to say. We want to keep it simple, but we need to show genuine caring. So caring and direct. We can use phrases such as, "I'm concerned about you. This was brought to my attention and I am concerned about you. You are not alone. Help is available. You are not alone." Let's talk about what support looks like right now. There are tools and resources available, and I want to help you. Notice what these have in common. They don't diagnose, they don't minimize, they don't ignore. We're not judging. What they do is they show concern, they offer connection, and they open a door to resources. There are resources available. Now, what to avoid? Because this is just as important. Don't dismiss the comment. Don't say something like, "Oh, you're just stressed. No, you'll be fine." We are dismissing, minimizing the situation. That can make someone feel unseen and even more isolated. Don't give an advice or try to fix the problem. We cannot fix the problem. HR is not here to solve their personal crisis. We're here to connect them to do and provide the right help. And don't promise absolute confidentiality. You can and should say, I will respect your privacy and only involve the people who need to know to make you safe. But never say that this will stay between us. Because if someone is at risk, you must act. If the person is suicidal or the person says something about hurting somebody else, we cannot keep this to ourselves. We need to contact 911. I want to mention that I'm going to be opening. I see some hands being raised, so I'm going to go ahead and allow you to talk. I'm doing that right now. It looks like some of you may have some comment. That gives me an opportunity also to see who is here. Thank you. Okay, so everybody should be unmuted. So if you want to jump in and make a comment as I'm going, please feel free to do so. Okay, documentation. Let's talk about documentation, because this is an area where HR often hesitates, right? But it is essential. Documentation protects the employee, but also the organization. And you, as the HR professional, So the key is to document facts and behaviors, no labels, not assumptions, no diagnosing, because we are not healthcare providers, but facts. It's not like, oh, I think, I feel, I believe, my heart is telling me. No. And this is not just here, right? This is with any also investigation that we conduct. We stick to the facts, okay? Maybe, for example, the employee stated, I wish I were dead. Maybe this happened when? During our check-in meeting. Maybe the employee appear, maybe tearful, withdrawn, isolated, quiet, when the employee was not usually like that. Okay, now let's not put or write employee is depressed, because depression is a mental health problem and we are not diagnosing. Okay? That crosses into the medical diagnosis. And again, that is not a role, definitely. And finally, balancing privacy and compliance. HR sits at the intersection of compassion, but also the law. We must protect confidentiality, but we also have obligations under ADA, FMLA, HIPAA, GINA. That means we share information only with those who have a legitimate need to know, like a manager or leadership, if safety is involved. But we don't broadcast the situation. And even if the employee is very vocal and very public, sometimes we see that employees are going to be mentioning, I suffer of bipolar disorder, or I have this, or I have that. Okay, but that's their choice. But sometimes managers, supervisors, and leaders, they feel that because the employee is sharing this information with a lot of people, that they can also share what they know. That's not true, okay? We also remember that mental health conditions are often protected, right, under ADA, which means that after a crisis, there may be accommodation discussions. And in certain cases, leave under FMLA may apply. So say things that show that we care, and open the door to help, for resources, for assistance. Avoid dismissing, avoid trying to fix and overpromising. Document objectively facts. Never diagnose, because we are not healthcare providers. And always balance compassion with compliance. This is what keeps HR grounded in a role. We are not therapists, we are not psychiatrists, but you know what? We are the bridge between someone crying for help and the resources that may save their lives. So creating a culture of preventive care. So up until now, we focused on what to do in the moment of crisis, in the moment of that crisis. But the truth is, suicide prevention in the workplace doesn't start with a 911 call or an HR intervention. It starts with the kind of culture that we create every single day. So let's look at some proactive steps that we can take to reduce the risk before the crisis ever emerges. And that means educating employees about mental health, reducing the stigma, but making it a normal part of the workplace conversations, ensuring leadership models openness. When a manager or even an executive shares, even in small ways, that they have felt stress or that they have used support resources, it signals to employees, oh, it's safe. It's safe for us to do the same thing. Upstream means proactive wellness initiative, programs that focuses on physical health, work-life balance, mental well-being, all of which will create resilience before the problems escalate. And then midstream strategies, they come into play once challenges are already present, but before a full-blown crisis. And this could include peer support programs, where trained employees check in with colleagues, or simply ensuring that supervisors know how to spot concerning changes in behavior and then follow up. About regular pulse surveys, about one-on-one check-ins. Open conversations about stress are also midstream tools. They give employees safe spaces to talk before the struggle turns into despair. Downstream strategies are what we rely on when a crisis happens. This is where your protocols matter. Clear crisis response plans, knowing how to activate the 988 line, or involving local crisis partners. Postvention support is also critical. What happened after an incident is going to affect not only the individual, but the entire department, the entire team. So HR should ensure safe debrief, provide reassurance, and prevent gossip or stigma. And of course, return to work and accommodation planning is vital. It's vital when an employee comes back after a crisis or time away. We are not in this alone. There are excellent toolkits and guidelines available. So there are organizations that provide a lot of support. And remember, we are the bridge. We are the bridge between the employees, leadership, and policy. So that means that we must normalize conversations around mental health. We must align our practices with the CDC's 2024 national strategy, which calls for workplaces to take an active role in suicide prevention. We must build trust, and that's going to be through consistent policies. Yes, but also through humanity. Because at the end of the day, creating that culture of preventive care is not about checking a compliance box. This is about making sure that our employees feel safe to speak up before their pain becomes unbearable. It's about shifting from reactive HR to more proactive HR, where we just don't respond to crises, but we help prevent them. Okay, as we come to the close of today's session, I want to leave you with a couple of reminders. Again, the hotlines and community partners. The 988 Suicide and Crisis Lifeline is available 24/7 nationwide. 988. We need to memorize this number just as we know 911, right? Yes, 911 saves lives. What about 988? You think that it saves lives? Absolutely. Just like 911. So I also encourage you to identify your local crisis centers and hospitals, nonprofit partners, because those connections can make all the difference. Also, another reminder, HR is more than compliance. HR is the leadership on the front lines of humanity at work. When we respond to a sort of suicidal comment with, I'm going to say, with compassion and with compliance, you are not just following policy, you are potentially saving a life. That is huge. That is powerful. That is leadership. So as you live today, remember, you now have the awareness to recognize the signs. You have guidelines for what to say and what not to say. You have the tools to respond with care while respecting the legal boundaries that protect both the employee and the organization. This is not easy work, but it is meaningful work, and you are not alone. Together as HR professionals, we are building workplaces where no cry for help goes unheard. So one more thing, and then I'm gonna open it up for questions and comments. Again, some employers, they tell me, but I mean, Elga, what options are available for those smaller employers as they don't have employee assistance programs? So yes, absolutely. There are things that we can do to provide the support, right? Respond with immediate compassion and concern. Listen without judgment, no judgment. And thank that individual for opening up. Listen actively and thank them. Express empathy. Like, I'm really sorry to hear that you have been struggling. I want you to know that I care about your safety and your well-being. Assess the urgency. Remember, if the employee is suicidal, you need to ask them. And if they say yes, you need to call 911 or your local emergency number, but right away. Now, if the employee is not in immediate danger, but is struggling, provide the resources and support quickly. Provide crisis resources. Again, if you don't have EAP, share widely accessible resources. Look around your local area. 90-day suicide and crisis lifeline. They can call, that they can text 90-day also for free confidential support 24/7. Encourage them to reach out to their primary care providers or to a licensed mental health professional. You can even help them make the call if they seem overwhelmed. Offer workplace support, flexibility. How about some temporary adjustment? How about flexible scheduling? How about time off? How about if the employee needs to attend therapy or they need to take a break? Confidentiality. Keep the disclosure private, sharing only with those who must know to ensure safety. Check in. Follow up gently after a day or two so we can show the continued care and the support. Establish external partnership. Well, since you don't have EAP, you can build a resource list of local mental health providers and clinics and crisis centers. Explore community resources and organization and education. Train managers and supervisors. Equip your leadership team with mental health first aid or suicide prevention training. No, you're not expected to be the therapist or fix the situation. Remember, your role is to show empathy, connect the employee to immediate crisis resources, and create a supportive workplace environment. If there is any risk of imminent harm, then treat it as it is, which is an emergency situation. Okay, so I'd like to invite you to any questions or comments that you have now. Let's open it up for reflection and for questions or comments. Maybe some of you have faced situations like this in the past. Does anybody wants to provide any comment? Any comments? I saw a couple of hands raised. Nobody? No comments? We still have a couple of minutes around here. Let me look at the chat. Maybe there was something in the chat. Oh, thank you.
This was very good, Elga. Very good information. Thank you for presenting this.
Thank you, Teresa. I really appreciate that. Erica, did you have a comment or a question? I saw your hand. Okay. Do you want to know what I'm going to be covering next month? Anybody's curious?
Yes.
Somebody is. Who was that? That sounded like Ricardo.
John.
Who was that?
John.
John.
Oh, is that John? Oh, okay. Is that John? Okay. Let's look at what we're covering in October. What is October? Okay. Mental Illness Month. October free webinar, when HR has mental health problems, the law versus the reality. Remember that we always say that nowadays, oh, we want to talk about mental health. We want employees to be open. We don't want this to be a taboo topic anymore, right? We want employees to talk about it so we can provide the resources and the tools, right? And we know it's part of the strategy, because we want employees at work. We want them at work because we don't want them at home, sick, with depression, with anxiety, and basically using a sick day. And then at work, we have to incur overtime, pay them more money to get more accidents. Yeah, the more overtime, the more accidents, the more errors, the more mistakes. We lower employee engagement. How about when you are self-funded, you're incurring health expenses? Okay, so we want to talk about mental health problems, right, in the workplace. But what about when HR is the one that needs support? Going back to what I covered last month, we are here. HR is here for everybody. But who is here for HR, right? So what about when we say, I'm the one with depression, with anxiety, with bipolar, with schizophrenia, with this, with that? What do you think? What do you think they're going to say about, ooh, she's the one conducting internal investigations? She's the one making some maybe hiring decisions, making recommendations. So what happened? Again, the law versus the reality. I'm going to be honest. I'm going to tell you, this is what I want to share next month. I have some HR friends that as soon as they disclose to their bosses their mental health problems, they start taking their access away. Oh, you have performance problems, and eventually terminations. What? Reality. So let's talk about that. I want to talk about those topics that not everybody wants to talk about. I do. So Wednesday, October 22nd, 11 a.m. to 12 p.m. Eastern Time. Okay, so before we officially close, I want to leave you with one quote that truly captured the heart of today's session. Okay, so recognize the signs, respond with compassion, and lead with courage, right? Because in HR, it's easy, almost expected, to give and give until there's nothing left, right? So as you leave this session today, okay, I want you to remember that you matter just as much as people you do serve as well, okay? So we have covered a lot today, from setting boundaries, right? And recognizing those signs. So I want to thank you. Thank you for spending this 1 hour with me. Okay. So there is a 1 hour credit. This time I didn't forget. Sometimes I forget. There's the HRCI. There's the charm. If you had not given me a Google review, I would like to ask you that you leave me a Google review. If you already did, you don't have to do another one, because if you do another one, it just overrides the first one, okay? But if you had never given me a Google review, I would like to ask you to do that if you enjoy this webinar. Remember, your humanity is not a weakness. It's your superpower. Because as HR professionals, we're not just policy enforcers. Remember, we are lifesavers. We are. So until next time, be kind to yourself, leave others when you can, and never forget the power that you hold when you show up as your full, authentic self. And until then, look at that. 12 p.m. Are you proud of me, John? 12 p.m. Thank you so much, everyone. And I will see you next month. Thank you. Thank you. Thank you. Thank you.